You don't go to therapy because you have a problem. It's a personal growth, and it's very important for everyone.
Interesting statement. Yeah. So it's not necessarily because you have to have problems. It helps you to grow individually.
Exactly. The therapist is like a mirror. You cannot see your back until you have a mirror. And a lot of the things that we're dealing with, it's our blind spot. It's like looking at our back. When people come with trauma, they're very fragmented. And if you don't have that ability to hold the space for them, they can become more fragmented. Biological depression, that sometimes we don't know exactly why it happens. And in those cases, you sometimes need medication. In biological depression, it's good to sometimes seek psychiatrists and medication. You can also look into other ways of dealing with that.
You can sometimes even do both, right?
You can do both. You can always do what is expected from us.
To do what is right as expected, right?
To do what is right and to do mostly what is expected from our parents, society, teachers. And then we disconnect. As a mother, as a daughter, as a friend, what is expected from me? Then the question is, whose life I'm living? As Jungian therapist, is to really bring that attention inside. Who am I? Who are you as a person?
Hello, and welcome to another episode of Beyond the Scrubs on CubeCast, a new and original podcast show. My name is Sarush, and I'm your host. Today's topic is about psychotherapy and how it's used to treat social, emotional, and mental disorders by increasing self-awareness and providing a deeper framework of understanding the individual self. We'll be talking about specific topics such as depression, mental health, problems in relationships, taboos and stigmas surrounding psychotherapy, and some of the ways and better ways to seek help. Tonight's guest is a very special guest. She's a psychotherapist, specifically a Jungian psychotherapist. Of course, from the works of the famous analytical psychotherapist, psychologist Carl Jung. She's got over 18 years of experience. She holds a bachelor's degree in French literature, a bachelor's degree in psychology from Concordia University, master's in counseling psychology from Pacifica Graduate Institute, and a PhD in depth psychology with emphasis in Jungian psychotherapy. Again, from Pacifica Graduate Institute. It is my honor and privilege to have Dr. Shirin Gerayeli tonight in our show. Shirin, thank you so much for coming.
Thank you for having me, sir.
Thank you for being here. So first and foremost, can you tell us what Jungian psychotherapy is? What is Jungian psychotherapy?
Well, we have different kind of therapy. We have, for example, if I want to give you some examples, we have cognitive behavior therapy known as CBT. We have a lot of like dialectic therapy, we have somatic therapy, and Jungian therapy is one form of therapy that seeks to bring more balance and union between conscious and unconscious mind. And we look at the unconscious as a source of wisdom and a lot of potentials.
Okay, so we'll get back into that a little bit, I think, later in the episode about specifically what you do and what kind of patients you deal with. But going back to your history and how you became a psychologist and a psychotherapist, can you tell us about your own background and what your education was about? How did you face some of your challenges? I know obviously you started your education in Iran, but you moved to Canada and then in the United States. So can you maybe tell us about your background and how you started?
Sure. I had a degree, I have a bachelor degree in French literature back from Shahid Beheshti University in Iran, in Tehran.
That's a very prestigious university.
It was a good university, thank you. But and I was working in Iran and I had a very good job in Iran Khodro, one of the largest industrial company in Tehran, Iran. But I always was fascinated to Jungian psychology and I thought, okay, if I want to continue my study, I didn't have much option in Iran, so I had to move. So I moved to Canada, and then I started my school at Concordia University. So I started my psychology degree.
That's in Montreal, Canada.
In Montreal, Canada, yes. So I moved alone to pursue my dreams, and then I went to Concordia. I had my BA in psychology. I look into the different universities in Canada, but I couldn't find exactly what I wanted. And I knew in Santa Barbara there was a Jungian school. So I decided to move to California to continue my school. So I went to Pacifica Graduate Institute. I started my master's degree there. And then I continued for my PhD. I got my PhD in depth psychology with emphasis in Jungian psychotherapy.
Younger. And then you moved back to Canada to start your
Yes,
career here?
I moved to Canada when I started my PhD, and then I had my first child. Then I had to, decide. Well, like one of the concern for me was, okay, if I become a mother, can I continue what I really like? Then I was thinking about it, which path I really want to choose, to become a mother or to really go back to school. And I decided, okay, there should be, in Jungian psychology, we always say we have to hold the tension of the opposites. It's not either or. And you have if you can have the capacity to hold the tension, then the third can be born. And for me, the third was not either or,
either having like a mom,
either to be a mother or go to school.
Okay.
I decided that, okay, I'll go to school. And, and then when I went to school after that, I had my child. So I went on maternity leave. But being in a school, knowing a lot about the attachment and, you don't want to be far from your child. You don't want your choices to affect your child. So I decided, I was at that time in Montreal. So I decided when I needed to go to school, I take my husband and my child with me to school in order to be able to finish my PhD program.
So you were going back and forth between Santa Barbara and Montreal, which Montreal was your base, but you're doing your...
Yes, and then after a certain time, I recognized that it's really far because it was 5-6 hours of direct flight, and sometimes I couldn't find direct flight. So I moved to Vancouver, and then I had my second child.
Wow.
So it was
Was your second child during your PhD training?
Yes. And that's why it took me a lot of time to finish my dissertation, but eventually I did it.
Eventually you finished. Wow, congratulations. That's fantastic.
Thank you.
I think one of the themes that comes up in this discussion is not necessarily about what you're doing and how you're doing it right now, but about the process that it took for you to get there. And it's very inspiring to see that not only were you an immigrant here trying to obviously redo your education, second bachelor's degree, obviously in a different language, English, and then also pursuing your dreams, but also the challenges of becoming a mother. And I think that's something that, a lot of girls and women, as they're growing up, obviously, they face. And it's very inspiring to see, that you were able to do both at the same time, not only just one child, two children, while you're getting your PhD. Can you tell me a little bit about both of these challenges? Maybe start with a little bit of your immigration and the challenges based on that, and then also specifically a little bit more of the challenge of having your children while you were in your PhD program.
Well, being an immigrant, it's always a challenge. Specifically, I was young. I moved alone. I left my family behind. I had a very good job. I had a lot of friends back home. It was a big decision for me to move.
Wow.
And when I was leaving the company, the CEO of the company asked me, why do you want to go? You have a very good job. You have a very secure job. And I asked him, he said, what do you want? And I said, as a woman, I have a limitation in Iran, and
to grow and
become who I really wanted to become. And I always wanted to study Jungian psychology. And he asked me, what do you want? I said, listen, I can grow, but can I have your position? He said, do you want my position? I said, no, not specifically, but there is a limit to my growth. And that's my dream. And I want to leave and pursue that dream. And I'm very happy that I did it. It was very difficult.
So you came by yourself? You just moved to Canada?
I came by myself, yes. I came by myself. I did my BA. There was some counseling program, but I knew specifically that I wanted to study Jungian psychology. And that's why at that time I decided to apply for student visa in US and move to US and started my master's. And then when I finished, I moved back for a certain amount of time to Canada. And then I was traveling back and forth at that time.
So to a lot of, young, girls, teenagers, and young women, and not just girls and women in general, men as well, right? When they say that it's very challenging, for example, to have a family, but also to pursue this high level of a career and getting a PhD, what is your message to them in terms of the challenge, and also at the same time, you said being able to, it's not an either or, being able to do both at the same time. What is your message to them to
Well,
inspire them?
my message to them is just pursue what is important. It's not about having a PhD. To be honest with you, when I wanted to go to school, when I finished my master's, I wasn't sure if I wanted to go to PhD or not.
Yeah.
But the school for me was the time that I was disconnected and really attending to something that was very valuable for me. And that's why I decided to move forward and continue my education. So whatever you do, it might be in education, it might be your passion, you have to really look within, inside you, to see what really matters most to you, not what is really expected from you, And I think in that moment, you're willing to do sacrifices. It's a choice, It's a choice that you mindfully have to make. And any choice that you make in life come with the consequences. And we have to responsibly...
Obviously, you gain something, you lose something.
Yes, no pain, no gain. You have to let go of something in order to get something. And I was willing to do those sacrifices in order to get what I really wanted. But also, I had a supportive family. Like when I left Iran, my father always told me, whenever you want to come back, you're more than welcome. So I had that option. I knew I could go back, but I always, in the difficult days, I saw, okay, it's difficult, but I can do it because I have a goal, and I will. Yes, and I continued. Yes.
How did this goal develop in terms of specifically wanting to do Jungian psychology? Like, that's a very specific thing.
Yes, I was reading Jung when I was a teenager. Then there was a woman back home in Iran that she started to have some class about Jung and his theories and his concepts, and I became fascinated and I really enjoyed. So I decided to really continue.
So it kind of like resonated with you, and you really felt a deep connection to be able
exactly. Yes, and when I moved to Montreal, I remember I was very young. I was in my 20s, and Montreal had a Jung Society of Montreal, and they had every Friday lectures. Being a young girl, I really sometimes my friend called me, "Do you want to come out?" And some Fridays I went there, and it was a big gap between me and other people in Jungian Society, but there were lectures, and when I sat there, when I listened to them, it really resonated. Something was fulfilled in me. So I knew this is something that I really wanted to continue. I was really passionate about it, and I love what I do.
Wow, that's fun. It always shows in your enthusiasm, just like the energy that you portray, and that's fantastic. So it's very inspiring, I think, for all of us to hear that, you had such a goal, you had a passion, you went forward for it. You did it regardless of whatever, pressures or stresses that came with it. And you had a goal in mind, and you did it. And it's just basically get the job done, right? So how long have you been in practice? I think it's over 18 years.
Yes, when I finished my master's, I started to do internship. Like not when I was doing my master's, I start my internship, and then after that, I continued.
Just continue working and being in practice.
Yes.
Okay. And obviously, you've just been in Vancouver, BC, practicing for quite a few years.
Yeah, now it's been 11 years that I live in Vancouver, and I have my own private practice. I used to work for different agencies, but now specifically, I do only private practice.
Okay. Interesting question. Sometimes it comes up, people ask me, is that obviously this is your area of expertise and you help people deal with a lot of stress, both personal and professional. Did your own training and what you were studying actually help you quite a bit for managing your own stress? Like, was that something that you used on yourself? It's actually, I'm interested to know about
Interesting questions. Before I start my study in psychology, I was introduced to meditation. You know, from
Okay.
very early ages, I started to do TM. Then I had a trip to India. So I was introduced to Vipassana meditation. That helped me a lot in my life. And that's something that I still use, you know, to this day in my practice, in the, you know, in the way I look at life. And that's
Yeah.
one of the main tools that I use to work on myself. And obviously, you know, when we were doing our masters, we were required to do some personal therapy. And at that time, you know, I was a young girl. I didn't have, you know, I was in my 20s. I didn't have that much of a, you know, serious problem to consider going to therapy. And then I resisted a little bit. I said, 50 hours of therapy, it's a mandate for these masters, you know, but I started.
Yeah.
And I became fascinated, you know. I
You saw
recognized
the
that
power
you don't,
and
yes, I
yeah.
saw the power, and I
Yeah.
recognized you don't go to therapy because you have a problem. It's a personal growth, and it's very important for
It's very
everyone.
interesting statement. Yeah. So it's not
Yes.
necessarily because you have to have problems. It
No,
helps you
in
to
you
grow individually.
exactly. In Jungian psychology, we do
Yeah.
believe that we all have the shadow. What is the shadow? Is a part of our psyche that we press down to the unconscious, whatever we don't want to be. You know, we have certain values, for example, from the society, from the family, to be this, and the opposite goes to the shadow. And you cannot be aware of your shadow unless you work, you know, with someone in therapy. Working in therapy is like, the therapist is like a mirror, you know.
Oh.
You cannot see your back until you have a mirror. And a lot of the things that we're dealing with, it's our blind spot. It's like looking at our back. And we cannot be aware of them
Interesting.
unless we can get help. So in that time, I was, you know, sitting in the other side, not as a therapist, but as a client. It gave me a lot of, you know,
Perspective yeah.
towards, you know, the potential, the patterns that we all have, the places that we are stuck in life, how to move forward, how to have more consciousness around our choices. So that was one of the things that also helped me.
Okay, very interesting. So, a very interesting statement. You said that it's not about necessarily getting help and, you know, for
Having a
therapy, it's about growth and becoming a better self, right? Like improving yourself. So you're in private practice. What kind of clients are you seeing? Are you seeing mostly like individual and like couples? Do you do couples
I
therapy?
do. My master's is in marriage family therapy, so
Okay.
I sometimes work with couples as well.
Yeah.
I used to see kids before when I had my own, you know, office. Now I work mostly online because I used to do play therapy, Sandplay therapy with them. And kids usually require some means and help in order to express, you know. Talk therapy, sometimes it has its own limitation for
Okay.
kids. And I have a training in Sandplay therapy.
Sorry, what is Sandplay therapy?
Sandplay therapy is a form of art therapy, and we have sand tray therapy and sandplay therapy. And sandplay therapy is more Jungian way. There was a woman, Dora Kolf, that she was trained by Jung, and she introduced, you know, this way of therapy that is a box of, you know, a specific size box of sands with specific dimensions
Okay.
and colors.
So sand, like just sand.
Yes.
Okay.
And then we put sand inside. There are small figurines, and then you can have variety of figurines, and they're very expressive. And sometimes kids or people with trauma specifically, because they have limitation in, you know, going to their trauma and explaining their trauma verbally, they really needs help. And that's a very good help of getting into their, you know, memory.
So instead of like verbally expressing what's going on with them, they can use sand therapy
because with Sandplay, when you touch the sands and you go to your implicit memories, you can get to the places that you were stuck and the trauma happened. And for kids also, it's very interesting because they can express what verbally they cannot express. But the role of the therapist in Sandplay and usually in therapy is very important because you work with serious matters, the trauma in Sandplay and in regular
Very
therapy as well.
interesting. Yeah.
And if you don't work on yourself, Jung had a sentence that he said, you cannot take your client further than the places that you have been. So it is very important to work on yourself, to develop yourself, to be aware of what are your problems. One of the things that you go to therapy, as a therapist, you seek help because you want to be aware. We all have our own problems and brokenness.
course,
I cannot say because I'm a therapist, I don't have any
Of
problem.
course, everyone has it. Yeah.
That's being human.
It's like me saying I'm a chiropractor, I don't get injured.
Yes,
Yeah, I get injured too.
You have your own personal problems. If you don't work on your own problems, it can get stuck on the relationship that you have with your client. And I think it is very important to be aware of those, to work on those, to develop yourself, and to be able to hold the space, because the therapist is the container. And sometimes people say, oh, you don't say much. Yes, I don't say much.
That's actually something that comes up. People say, oh, my therapist doesn't talk much.
Yes, but it is about your presence, You want to really be attuned to your client, to see your client, and to help them to process. And it is very important to have that presence. And again, work on yourself to be able, because a lot of time when people come with trauma, they're very fragmented. And if you don't have that ability to hold the space for them, they can become more fragmented.
So your role, one of your roles is to make sure that everything is contained.
Everything is contained, and you can really attune and attend to your client and what is needed in that moment. For every client is different what is needed.
Of course. So I guess in the current moment, does the Sand therapy work with adults as well? Or,
yes, of course.
So you do that as well in your practice, but now your focus is mostly on individuals and couples therapy, but mostly for adults.
Yes, and I do work with anxiety, depression, addiction, all sorts of...
Oh, yeah, these are your areas of focus.
Yes.
What would you say is probably your top 2 or 3 items? So is depression and anxiety couple of the items that...
Sure, because of my background in meditation, and also I was trained with John Kabat-Zinn. He is very famous in mindfulness. He was doing a lot of research in Harvard, and he had a lot of books.
Harvard University.
Harvard University. He had a lot of books regarding mindfulness. So I was trained in New York with him as a mindfulness MBSR practitioner, mindfulness-based stress reduction practitioner. And I don't teach that. I don't, do that on the group basis, but I use that technique in my, therapy with my clients with anxiety, sometimes based on what they need, like if a client comes with anxiety and, they don't know how to regulate themselves, I really work with some of the relaxations, breathing techniques, and to work with their anxiety. With depression, it's different, and, with trauma also, I do work. I'm in training, and now I'm in a 2-year training in Ireland with a new way of how to work with the body and the nervous system of the clients who had trauma.
Trauma, and specifically traumas cause depression.
Yes, and my dissertation was mostly about how to work with the body and how the importance of embodiment in psychotherapy. And that's why, I use a lot of, bodily technique, come back to the body. How do you feel in the body? And bringing more awareness to the body. Body has a memory, has a lot of wisdom that sometimes we don't know how to tap into the body's wisdom and access it. So it is very important for me, at least in my work, to bring more consciousness and awareness.
So specifically about a couple of these areas that you touched based on depression and anxiety, I think those are some of the, areas that come up quite a bit, especially, I don't know, correct me if I'm wrong, but I feel like the prevalence of depression and anxiety has become more, especially post-COVID. People are dealing with a lot. Life's become too complex. Everything's become too crazy. Can we talk a little bit about depression and what depression is, and how do we go about tackling depression in terms of that embodiment that you talked about, and
Sure.
recognizing the individual self and improving the individual self?
Sure. When we talk about depressions,
Yeah.
we have to recognize that there are different type of depressions. For example, there is reactive depression when you are in a relationship, when you break up, or when you face death in the family.
So you're reacting to
You're
something.
reacting to the situation, and it's very normal to be depressed, but it's also about the time. And if you cannot measure to say, okay, up to 2 months it's okay, but usually if it interferes too much into your life after a while, then maybe you need to look into it. But it's very normal to get depressed, right? We all do get depressed.
We all get it. Yeah,
Yes.
everyone does. It's
So-
part of the cycle of
Exactly. So reactive depression, it's really regarding, you react to the situation. But there is also biological depression that sometimes we don't know exactly why it happens. And in those cases, you sometimes need medication.
Seeing like a psychiatrist to
Things
get
like, yes. In reactive depression, sometimes you do need medication, but processing is very important. Jung said the only way, to liberation is not the real liberation happen not only from glossing over our emotions or repressing them, but by fully experiencing them.
Okay, so not
So-
like going off the surface, but like really feeling it.
Yeah, really diving into your feeling. That is very, very important, So in reactive depression, like you really need to talk to someone, to process it with someone. In biological depression, it's good to, to sometimes seek, psychiatrists and medication. And also, you can also look into, other ways of dealing with
And you
that.
can sometimes even do both, right?
You can do both. You
Yeah.
can always do both. But there is another one, is a psychodynamic depression. And that's about the conflict in the psyche, And the conflict arises when we live our life in certain ways that is expected from us. For example, when we are a child, they tell us, if you do this, I praise you. If you do this, I punish you. So we really learn for our survival and to be loved to really look outside, okay, to follow what is expected from us.
To do what is right as expected, right?
To do what is right and to do mostly what is expected from our parents, society, teachers. And then we disconnect. The British psychiatrist, the psychoanalyst Winnicott, he called that the true self and false self. When we look inside and we have that authentic relationship with ourselves, that's a true self. But when we look outside to see what is expected, what my mother wants from me, we find ourselves in the eyes of others. We slowly start to develop that false self. I look, okay, as a mother, as a daughter, as a friend, what is expected from me? Then the question is, whose life I'm living?
Are you living your life or someone
Or
else's?
someone else's life, the expectations of others. And then at that moment, our psyche sends off some signals. It has its own agenda to move forward. One of the Jung's concept is individuation. Individuation is really becoming oneself, to find our authentic self, to really unfold what it's about, my life, And if we don't walk in our path to become who really need to become, depression may come and just say, where are you going,
So you're saying this kind of develops over time. Is that what you're saying? That where you... when you're a child, this gets instilled in you, but as you're growing up and you become an adult, it can come out, and you have a difference between the true self and the false self.
Well, it's about, how we look outside, and the part of our work as, as Jungian therapists, it's to really bring that attention inside. Who am I? Who are you as a person?
Yeah.
What do you want? not what society wants from you. What society says it's a successful way of becoming this or that. What is it really needs to, to be born through you? Not is what my parents wants from me, what my partner wants from me, what my kids want. You respond to that, but very mindfully, but also attend to yourself. But if you don't, then, the psyche sends you messages. The psyche always sends you messages through your soul, through depression, through your body, a lot of the physical symptoms that we have.
So you're saying that if you're not attentive to this and you're not taking care of this, then it can lead to depression.
It can lead to depression. Yes, exactly.
Because there's an identity issue between what's expected of you and what your inner individual person is.
And the problem is in today's society that a lot of time, we go see our doctors and they say, here's your pill, medication. They medicate you to numb yourself from what you're feeling. But we cannot deal with our trauma, with our relational traumas from the past, with the problems that we have, with, a lot of things that happens in our life. We cannot numb ourselves from our feelings. We really need to process our feelings, right? And I don't want to say medications, are unnecessary. There are times
sometimes
that are absolutely necessary, right? But, you really have to be careful to pick the right medication, and also to really know why, why you're taking it. Is there any other way that, you can work on your depression? Sometimes the combination of medication and, psychotherapy can be the right way of dealing with the,
So would you say that regardless, doing psychotherapy in the majority of these types of depression and cases is quite effective?
It can be very effective, yes. But also you have to write the right therapist for you, that, you can have that relationship with your therapist. It is very important in the process,
So in terms of the types of clients that you see and patients that you see, and you said that depression obviously can, happen at any age. What is the common demographic of patients that you see where these types of depression, I guess not necessarily develop, but come out and show themselves more? What age range and what, men, women, or, is there like a higher degree of?
Well, you can see depression now in very young kids as well, as now with the problem of social media and kids keep comparing, they keep looking outside. Again, what is expected?
That's
what
right.
is the norm? How can I, comply to these norms and respond to what is expected? But I would say with the clients that I work with, but that's my, my personal experience in work, I would say the midlife is the time that I see a lot of depression.
Kind of like what, late 30s?
Like mid-30s to 45, 50, those are the time, because in the early phase of life, we are very, we put our time and energy to build our ego, to what is expected from us, to who I am, what is expected from me, who I want to be, to live a life that, to build that ego and ego strength. But in we may check all the boxes, and to go to school, to do this, to, become successful, to
get married,
have a financial,
have kids,
yes, to get married and then to have kids. But then again, sometimes you have all the, you check all the boxes, but you don't feel yourself. You feel a void in yourself. And
something is missing.
Something is missing.
Yeah.
Why did I follow? What was expected from me? And I still don't feel right. I don't feel myself. Okay. And then you come to therapy, and part of our work with these kind of clients are what are the patterns. We all have the patterns in life that we develop because of our early experiences. We respond to our early experiences, and our past, sometimes it's too much present, and then we fulfill people's expectations, and then we forget about ourselves.
But all of a sudden,
mid-30s,
mid-40s, this comes out where
this
you're
comes out,
like,
and
what am I doing?
It forces you. A psyche has its own agenda. You know, we
Time
think we
frame,
are
as you said, yeah.
we think we are in control, but when the depression hits us, we recognize we are not in control, and we really need to look into it and ask. I usually, look at depression as a messenger of the soul, and I ask my clients if it's not biological, and I ask my clients, ask your depression, what does it want from you? How can you connect to your depression? How can you sit with it and see?
Not numbing it, like
Not
really actually
numbing
facing
it,
it, especially like, yeah.
I'm not, because when you take medication, and
Yeah.
sometimes I have clients come to the session, there is no feeling to work with, And again, I'm not saying medications sometimes are necessary or very important, but they're not the first, way of responding to our depression. And we really have to understand, what is this depression wants from me? How can I work with it? How can I get the message?
So you're saying that it's very common for this to really come to the surface in your mid-30s, mid-40s, because you have gone through a lot of steps. You've been young. That's your early life. But now that you've, met all these expectations, now all of a sudden your inner person, inner individual,
Your authentic self
yeah,
really needs expression.
Expression,
Really
yeah.
needs you really need to find out, who am I? How do I want to live my life? Okay, I fulfill everyone's expectations, but I don't feel, fulfilled myself. So
that's, I guess, maybe when they say the common terminology of midlife crisis, would you say that ties into that that midlife crisis could be part of this pathway that all of a sudden now it happens? Because I see it around me. I'm in my 40s as well, and I kind of sense around me, and maybe including myself, that sometimes you kind of go back and say, and I've achieved all this, I've done all this, so now what? And even my friends and people that I see around myself, I think that's become a lot common when they're kind of starting to question things, where what was the point of maybe all this education, what was the point of that type of lifestyle, or all these choices that I made, does that kind of connect with me, or so what's how do you go about dealing with that? I know we talk about obviously seeking therapy and going about it, but sometimes that's a big jump for a lot of people, right? And so how do you recognize some of this, and how do you take smaller steps to be able to find better answers about who you are and your individual self and what you want?
well, I think in general, you have to look inside. Do I feel fulfilled? Do I have purpose and meaning in my
Yeah.
life? There is a very famous Jungian analyst, James Hollis. He said, the purpose of life is not happiness. Happiness is oversold to us. The purpose of life is meaning.
Oh, very
And
interesting. I think happiness is oversold to us. Always we think about, what makes me
happiness
happy.
is a momentary feeling. It comes and goes,
Interesting, yeah.
And sometimes we look for it. Oh, I'm not happy. But do you have a meaningful life? And sometimes in the search of meaningful life, we have to sacrifice our happiness. But there is more fulfillment there,
So finding a meaning to have fulfillment versus happiness, which is a byproduct of.
And it's okay. There is nothing
Yeah.
wrong with being happy. But I don't think that's the purpose of our life. We really need to find
Yeah.
meaning.
Because I think that's so emphasized nowadays, especially with the new generation, always talking about, oh, what makes me happy? Oh, this doesn't make me happy now. I'm going to change that. So you're saying that the actual true way of looking at it, based on the psychologist, is finding meaning in something,
Finding meaning in life.
sometimes at the sacrifice of happiness.
Sometimes, if something is meaningful for you.
Interesting.